Those samosas look absolutely incredible, guys. But now it's time to take a little bit of a throwback to last week, where I was joined by obstetrician and gynecologist Dr. Lusanda Shimange Matsose to discuss the journey of PCOS and infertility.
Salome Polycos helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with Salome. Your journey matters.
The personal health experiences of women are unique. However, where there are moments of similarity, those experiences can be used in support of each other in their personal health journey. So joining us today is obstetrician and gynecologist Dr. Lusanda Shimange Matsose to discuss the journey of PCOS. Welcome to the Loft, Doctor.
Thank you, Palisa, for having me.
Now, Doctor, we primarily refer to the physical effects of infertility, but those aren't the only effects on the body. What impact does infertility have on one's psychological well-being?
If you actually look at the whole process of getting pregnant, it's normally, generally speaking, it's something that a couple wants, be it a woman or a man. So if you are really having difficulty with that, and we're all societal norms and expectations, that does really have a psychological impact on the couple. I mean, and we see it quite a bit in our reproductive clinic, where we get patients who come to us because they can't fall pregnant and they want us to help them fall pregnant. And there's just those issues that need to be addressed. I always speak about a biopsychosocial model when we look at how we treat patients, is that there's the biological side, which as clinicians we can always sort out, but we must not forget the psychological part of it. So it really does have a great impact.
Now, Doctor, what are the common symptoms of PCOS?
The biggest one that I can really just really mention that a lot of women need to be aware of is what we call amenorrhea. So that's basically the absence of your menstruation. So in other words, you may skip a few months, maybe you have like 9 periods per year as opposed to 12 periods, or you have like short periods. The other one, which you can see physically, is what we call hirsutism. So hirsutism is male distribution of terminal hair. Ladies who have a beard or who have hair around their chest, down their legs, down their back. That's what we call hirsutism. So those are really the obvious things that patients could complain about. But obviously, after examining and investigations and history taking and so forth, we can elicit other things as well.
There is a link between infertility and the diagnosis of PCOS. Why is that, Doc?
There is amenorrhea with this absence of menstruation. But the other thing that happens with these ladies is that they don't ovulate, they have anovulatory bleed. And when you don't ovulate, then there is no, to put it simply, there's no egg, dominant egg to be fertilized by the man's sperm. So those patients generally may struggle to fall pregnant because of that anovulatory process that happens during PCOS.
Now, Doctor, what role do supplements like inositol play in assisting with the management of infertility due to PCOS?
I really like that question because, it's one of those treatments or supplements that you can buy over the counter, but sometimes may be incorrectly used. So I first want to say that unless prescribed by a health practitioner, rather don't go and get it, but it definitely does have a role in the reproductive sphere, in that women who generally have what we call hyperinsulinemia can benefit from inositols, and in terms of getting better quality eggs to fertilize and so forth. So there definitely is a room for it. I'm just guarding against patients or clients going to get it from themselves when it has not been prescribed by a health practitioner.
Thank you so much, Doctor, for joining us. Now, doctors and sisters are alike in that they're always willing to lend a helping hand. After all, we should be our sister's keeper. With Salome, your journey matters.
Cysts in the ovaries, irregular or missing periods, and high male sex hormones are symptoms of polycystic ovary syndrome. If you experience 2 of these 3, you may have it. It's also the leading cause of infertility in women. Salome Fertility helps regulate ovarian function and helps improve fertility. Salome Polycos helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with Salome. Your journey matters.